Good afternoon, everyone, and thank you for joining for this COVID-19 update. Addressing us will be Prime Minister, the Honorable Mia Amor Motley, the Minister of Health and Wellness, Lieutenant Colonel the Most Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. the Most Honorable Kenneth George, the Deputy Chief Medical Officer, Dr. Anton Best, and the Head of Isolation Facilities, Dr. the Most Honorable Corey Ford, is joining us virtually, and Minister Bostic will begin.
Thank you, Lisa, and good afternoon all. I am going to commence this update by just going back slightly to the month of December and coming forward, and I'm doing so because you would recall that we had a very challenging 3-month period when we were fighting Delta. It was very difficult, but we were able to wrestle with that particular monster. Most of December, the statistics of positive cases came from 3 figures down to 2 figures. And it was during the period, especially between the 9th and the 27th of December, that we would have utilized that time at the Ministry of Health and Wellness to help us to prepare for the anticipated arrival of the Omicron variant. And we did so because that is how we operate. We don't wait for things to come. And we wanted to be in a position where we could best address that situation once it arrived here. So that we would have spent a lot of time examining what we did throughout the Delta variant, learning from some of the lessons there, and also utilizing that to help us to prepare for the future. In addition to that, we would have partnered with some agencies, including the University of the West Indies, to help us to make some projections so that we could utilize that information to the best of our ability in order to help us with our planning. So that between the 2nd and the 4th of January so far, what we've seen obviously is an increase in our positivity rate, with 200 cases out of 896 on the 2nd, 538 out of 2,383 tests on the 3rd, and then yesterday's results, which I will give now, we were able to conduct 2,111 tests, and there have been 479 positive cases. 479 positive cases. We have been following what obviously has been an emerging situation globally, in India, in Europe, United States, and even within the Caribbean. And we would have noted that on the 3rd of January, for example, in the United States, they hit the million mark with 1,083,000 new cases. And on the 4th of January, 869,187 new cases. United Kingdom, there were just over 225,000 new cases on January 4th. So that there's a trend here as to what is happening globally, and we have been preparing ourselves as best we can, drawing on the experience that we would have had as a country and as a team. And I'm happy to say that we have all of those persons who were with us throughout the pandemic, and so we are in a position now to be able to make projections and to better prepare as we go along. So those are really the statistics for today. And like I said, we would have been preparing over the last several weeks, and I now would ask Dr. Anton Best, the Deputy Chief Medical Officer, to carry on with the briefing.
Greetings, everyone. Thank you very much, Minister Bostic, for the introduction. So as Minister Bostic indicated, we've been planning for the imminent arrival of the Omicron variant in Barbados for quite a few weeks now, since it was first announced by the World Health Organization at the end of November. So last week, as part of the preparation, we approached the University of the West Indies Cave Hill campus, in particular Professor Clive Landis, the principal there, and our colleagues, the public health group, who are working on COVID to assist us with modeling. So modeling is a statistical exercise, and it's not an exact science. It makes assumptions, and then it gives possible scenarios and based on variables and things that we know and things that we anticipate to give us an idea of what the potential disease burden is likely to be in Barbados when Omicron arrives. So the results of the estimates exercise were presented to us at the Ministry of Health and Wellness on the 3rd of January, and thus far have been extremely useful as we continue the planning process and even the implementation of activities to mitigate against the impact of COVID-19, in particular the Omicron variant in Barbados. So we looked at the worst case scenarios and the best case scenarios. We're obviously hoping for the best, but we plan for the worst. So what I will go through over the next few minutes, as just a summary of the outcomes of the modeling exercise. So we took into consideration the proportion of immunity in the population when we looked at the numbers of persons vaccinated. Our vaccine coverage is just about 53% of the total population. We also took into consideration immunity due to natural infection, and that works out to about 10% of the population is expected to be immune due to infection with previous strains of COVID. We also had to factor in the tricky thing that Omicron does, and as it partially evades the immune system, whether it's natural immunity or vaccine-induced immunity. And this is important because as one of the key recommendations in responding to Omicron is to strengthen your vaccine program, because the first-time vaccinations as well as boosters will significantly reduce the likelihood of death and severe disease due to the Omicron variant. So when we looked at the worst case scenario, we looked at a wave lasting in the order of 6 to 7 weeks. We believe that at the peak, we're looking at 3,500 cases per day, and the total amount of cases that we expect over this 6 to 7 week period is just over 91,000 cases in Barbados. If you looked at a better case scenario where you have a shorter wavelength of just over 1 month, you're looking at a maximum of 1,200 cases per day at the peak, which would then result in a total caseload of 23,000 at the end of a 1 month wave. So with Omicron, we are particularly interested in the burden on the healthcare system, and particularly the hospitalizations. When I talk about hospitalizations, of course, I am specifically referring to what happens in our isolation facilities. It's important for planning, so we have the capacity at the isolation facilities. It's also important for planning so we know how to protect other facilities, because of course the resources for the isolation facilities many times draws on the resources from the wider health sector. So in the best case scenario, we're looking at 1.2% of persons infected with the Omicron variant being hospitalized. And in the worst case scenario, we're looking at 3% of persons being hospitalized. And when I talk about hospitalizations, I'm specifically referring to the severe subset, which in our case are the ones that we flag as red under our isolation program. And we also estimated that at a maximum, persons would be in hospital on average for 7 days. So if you're looking at the 3% scenario, which is the worst case scenario, the peak in hospital, at the peak, we will have just about 700 cases in hospital at the peak of the wave. So some of the key messages, some of the conclusions and key messages from the exercise that we went through with our colleagues from Cave Hill campus of UWI is that given the high volume of cases anticipated, even if you looked at the better case scenario of a 30-day wave and a peak of about 1,200 cases per day, it clearly is going to overload our healthcare system. So they've recommended that we continue the focus on home isolation, and this is a program that would have started in August of 2021, but also self-monitoring and self-isolation is going to be very critical as we prepare for this next wave. Additionally, the colleagues recommended that we have to pay very close attention to large-scale isolation in terms of our capacity. So right now we have 2 facilities up and running. There's the Harrison's Point facility and Sun Bay Hotel. We are already in the planning stages of of securing additional sites at short notice for the expected surge in hospital cases. As I mentioned earlier, the colleagues from the UWI recommended full vaccination and vaccination with boosters. So for persons who are under 6 months since their second dose or final dose of a 2-dose regimen, we are recommending boosters for those who've gone past the 6 months. So let me rephrase that. So you're fully vaccinated and well protected up to 6 months after your second dose. However, after that, because immunity starts to wane, what we are recommending is that you get your booster doses, and you can get your booster doses at any site. If you are watching international news media, you would also see that there's a question mark about the potential impact on the pediatric population. So we are paying very close attention to that. We are in conversation with the pediatrics department, for instance, and our colleague pediatricians, because we have to be very mindful of the impact of the Omicron variant on children in Barbados. And that is it in terms of my presentation. I will hand over to the Chief Medical Officer, who will contextualize the current status and also what we are doing in terms of planning for the imminent surge of Omicron in Barbados.
Thank you so much, and good afternoon to all Barbadians and visitors alike. As Anton has indicated, we had a forecast or a model that gives us some direction as to what we will face. I use the analogy of a hurricane because many times we need to be prepared. There may be a Category 3 hurricane coming our way. Unfortunately, over the years, Barbados has been spared. But it gives us a sense how we need to prepare with respect to Omicron. As you are aware, I reported a single case, and we are working with CARFA to ensure that the 40 samples we have sent to them, we get back those results in a timely manner. And soon as those results are known, we will share it with the public. With respect to moving forward and our plans, we believe that it is critical that based on these models, we use self-isolation as a means of containment. And what is self-isolation? Self-isolation is the process in which individuals will remain and stay put in a particular place for up to 10 days at a time. This makes sure that that individual does not mix or mingle with individuals who are close or within their immediate presence. But the whole concept of self-isolation is built on personal responsibility and commitment. We will be there to hold your hands during the process of self-isolation. But what I am asking the public to understand is that because of the high numbers, you will be isolating with minimal medical intervention. We will hold your hand if issues occur. As Dr. Best mentioned, we have 3 categories: green, yellow, and red. The reds are easy. Those are the individuals who will require almost immediate attention, and that will be provided by Harrison's Point or any such isolation facilities. The greens are individuals who are asymptomatic or very mildly symptomatic and do not have risk factors for an adverse outcome for COVID. Those individuals will be the individuals under the self-isolation program. And then the final category is the category in the middle, the yellow category. And what we have decided based on good public health advice is that those persons who are yellow and are not vaccinated are the individuals who will require an assessment in a facility. The individuals who are yellow and who are vaccinated, we will keep a special eye on you, but you will be quarantined at home. So that is our plan with respect to handling the large surge. The next part of our plan is, Anton alluded to it, is with respect to giving our population boosters, which is the best chance for us, for you and for us to be able to protect ourselves. Many of you know that Barbados was way in front of the Caribbean. We were way in front of the Caribbean with respect to vaccinations, and we were way in front of the Caribbean with respect to booster shots. We are under 50% of the population who could be boosted, and we would like to see that rise to 70 or 75% very shortly. But boosters give us the best opportunity for protection. And then again, I would certainly encourage persons to be those who have not been vaccinated in a time when a virus spreads extremely quickly. And once one single member of the household is affected, it is almost over 90% of the time that all individuals in that household will be affected because it is highly contagious. And therefore, the means to protect yourself remains the timely measures we have indicated to you on several occasions, plus the need for vaccination. Finally, we will continue to work with you. We will hold your hands. We will continue to give information to the public with respect to where we are at, and we can manage this together. We have gone through Alpha, Delta, Omicron, and we will come to see this pass. Fortunately, the projections are for a short and sharp wave, and hopefully we can see this through in Barbados also. Thank you so much.
Thank you very much, Dr. George. And the Prime Minister will now address the country.
Ford goes before me.
You are correct. Dr. Ford, I apologize. You are next.
That's okay. I'm not forgotten. Good evening to all Barbadians. And I feel as though after listening to the CMO and the Deputy CMO, that I need to really give some assurance to the general public. You know, yes, a storm may be coming, and I've been down this path before. But I think you need to understand that whatever challenges come, that certainly we as countrymen can soar above our challenges, recognizing that in life, sometimes there are highs and low periods, as in the pandemic, there are high and low periods. But whatever the challenges that we're faced with, we as countrymen must be optimistic, and we must rise above all our challenges. And I've always told the general public, as we prepare, certainly are in preparation phase and in active phase for Omicron, and the advent of Omicron, I've always said that what we've always done, certainly as a team, is to look to see what's going on globally. We've looked to see what's going on regionally, and we've looked to see what's going on locally, and looked at our resources to see best how we can utilize our resources in the presence of the challenges ahead. And I think that's exactly what the CMO has outlined today for all of you. But I think the most important thing, even if you're fearful, and I know there may be an element of fear among the general public, and I'm here today as well to try to get across to you that it's okay to be fearful, but it's often very important to prepare. And preparation becomes very important in the presence of Omicron as we look to see what's going on across the world. What can you do as a general public to assist us, certainly in the isolation area? And I might surprise you today, because I generally believe that all of you in Barbados, everyone who's listening to my voice today, that you generally understand what you need to do. You've done it before, we've done this before, and I'm sure that you know those key things that you need to do. And so I'm not here to tell you you're not doing this and you're not doing that and go down that line at all. What I'm here to encourage you to do is to encourage you as you listen today to do the things that you know are the right things to do to get us through this bump that is going to occur. And certainly we can soar above this challenge, soar above the storm. Now, what can you do? As reminders, you need to wear your mask, keep it on, keep it well fitted. Don't wear it behind your chin. You're probably tired of me saying that and tired of us saying that. But these are the key things. Distance yourself when you can. But if you can't, make sure you have your mask certainly in place out there. Get boosted. That's what the evidence show, that the persons with boosters are not getting into that much trouble. Things that you don't like me to talk about probably, but get vaccinated, right? Those are the things that are going to assist you through this battle. And the one that we've not spoken about much before is obviously when the cases of Omicron hit, the numbers are going to increase, and we understand that, and you're going to ask to be isolated at home. So the next part you're going to do to help us is to stay at home for the period which you're told to stay at home so that it doesn't continue to spread throughout the communities. Ultimately, if every single one of you on this call or conference or meeting adheres to those particular events, we would ride our way safely through this storm and soar above the challenges which would occur. In our isolation facilities, what are we seeing? In our isolation facilities, and both in primary isolation B and A, primary isolation A, as you might remember, not spoken about it before, long ago, but in our primary isolation area, most sick people are, we only have 7 sick people. In our primary isolation B, we have a total of 12 individuals. So that gives you a total of 19. Out of that 19, 13 of them are above the age of 61. That's a large population which you need to get boosted as well, or those who have not been boosted or get vaccinated. And that alone spells the story. We have one person between the age of 20 and 30 in that group who's there. And I'll take the opportunity as well, as I encourage you to try to prepare for the oncoming event, certainly of Omicron, to tell you that we've had several successes, and one of those successes recently was our ability to extubate an individual. That means take that tube out the mouth, and that person is up well and fine. And that's something I really want to congratulate our intensive care team for at the facility. But to also make you aware today that unfortunately today we lost a young child at our Enmore facility. Who was the age of 14, who had other underlying conditions, which I'm unable to discuss certainly at this meeting, but he was extremely ill. And us, for our group at isolation, and on behalf of the pediatric team, we give condolences to the family with regards to that particular aspect. But be assured that certainly for us in isolation and those in the Ministry of Health, that we're going to continue to fight to get past this particular surge. We have been here before, Barbados. We've been here before. All of you have been afraid, you've been nervous about all the different waves, the Alpha, the Delta, the Omicron, whatever else is to come, even the one in France that's out there lurking. And we're all afraid. But I think if we continue to do the things that we know are right, if we continue to follow the protocols, that I believe that we will walk our way through this quite safely. So I encourage you to do that today and continue to support us certainly in the isolation team, and also continue to support us certainly at the hospital level. Thank you.
And thank you very much, Dr. Ford. And now we go to the Prime Minister.
Thank you very much, Lisa. I first of all want to say good afternoon to all Barbadians, and to say that I'm here this evening with the officials from the Ministry of Health, because I think that when I spoke to you on December 27th, I indicated in very clear language, and I look back at it, that Omicron is coming and it will impact us, and that I want us to approach Omicron and fight it as one nation. The truth is that we know, and the modeling which has been done, as you heard from Dr. Bess and Dr. George, is a model and a forecast. And Dr. George has appropriately contextualized it for us, because as we all know, forecasts don't necessarily always come through. Indeed, as he would have reflected, the earlier forecasts that we had at the beginning of this pandemic, we actually never reached the level of numbers that was initially forecasted. But we believe, and this government has supported the view, that we need to be frank and to share with Barbadians at all times that which we know and that which we are planning for. Our strength in this pandemic has been our ability to plan. Our strength in this pandemic has been our ability to communicate. Our strength in this pandemic has been to build partnerships with Barbadians, regardless of where they are, because we recognize that no single entity can solve this problem or can fight back this problem. And that is why Minister Bostic has continued always with the rallying call of no retreat and no surrender, because we need Barbadians wherever they are to join us in terms of their individual behavior and the personal responsibility that they exhibit to minimize the extent to which this virus can run through this society. We've indicated, therefore, that this modeling helps us with the planning. And let me contextualize it. When we went to Harrison's Point at the end of February of last year, we didn't know what we were going to be facing, but this government determined that we needed to prepare for the worst and hope and plan for the best. The bottom line is that we were able, therefore, to put in place a dedicated facility in a way that had not been done by any other Caribbean territory, and that has served us well. When we knew that Delta was about to come, we were able to turn from the secondary isolation unit at Harrison's Point into primary ICU facility, so that we could have dedicated oxygen and dedicated facilities, not just for the 38 in primary ICU, but now carry it to 80 with that secondary ICU. When we realized that Delta was going to be with us for a little longer, we converted the tertiary into secondary and primary. I say these things because what has happened here this evening should not take anyone by surprise. Minister Bostic and Dr. Bess and Dr. George indicated that the Ministry of Health reached out to the University of the West Indies through Professor Clive Landis, who is the principal and who himself is a distinguished virologist, to be able to assist us with the modeling. The results of that model is what we would have shared with you this evening. We don't know where we will land, but we do know this, that if we continue to prepare and if we continue to work together, we will get through this just as we have gotten through the other phases. And may I remind us of what really confronted us in each of the different phases. At the beginning of 2020, no one knew what this virus would do. And I still believe that that was the period where the fear and the anxiety was probably the greatest, even though the incidence of cases and hospitalizations were not as great then. And why? Because when you look into a dark hole and you don't know what you are seeing, then you are at risk of fearing for the worst. I've told Barbadians throughout my public life career that fear is regrettably one of the most paralyzing emotions, and that I have learned in life that the way to confront fear is to determine what is your worst possible outcome and work back from it. If we can deal with our worst possible outcome and work back from it, then we can get through this. In this modeling, the worst possible outcome is actually less than what I had initially feared. But the reality is that 3,500 at that level per day can be rough. The only good thing about Omicron is the fact that the level of hospitalizations and the level of serious illness is expected to be significantly less than it would have been with Delta. And that is why you would have heard Dr. Best say that in the worst case outcome, the numbers that you're probably looking at in terms of hospitalization are 700 at one time. I am here to tell you that Dr. Ford has already advised us that at its height in November, we had over 1,100 in our care. So that when we begin to contextualize that, then you can see why Dr. Ford and Dr. George have both indicated that we have been here before and that as a country, Barbados can do this again. Our difficulty, however, is that if we don't act responsibly, things can get out of hand. And that is why we continue to say to each and every Barbadian, the responsibility for yourself is yours. And even with respect to the introduction of the protocols for self-isolation, it is going to be you who will have to help guide and protect yourself. The truth is that in almost every instance, we know that there are a lot of people who are just very mild, but there will be a few who will get sick. And we have to prepare to take care of those persons. And we have to be concerned as well that the impact on the healthcare system, will have implications for others who may not have COVID, but who require the services of our healthcare system just as urgently as those who have COVID. It is against that backdrop, therefore, that I echo the call from Dr. Best, from Dr. George, from Dr. Ford, to encourage Barbadians to go for their booster shots. If you have had your first 2 shots more than 6 months ago, and in particular for those of you who are older and vulnerable, we suggest that please go for your booster shots. For those of you who have not had any vaccinations, we are not, in this case, as we said before, we don't mandate, but we ask you to consider that the evidence and the science is clear, and that persons who are vaccinated stand a far better chance of survival against hospitalization, survival against, regrettably, loss of life. And to that extent, therefore, we ask you please to put yourself in a position to protect yourself at all costs. But vaccination has never been and will never be the only protection. The protection continues to be the mask, and wearing the mask continues to be the sanitization, continues to be distancing where possible. And we ask persons to be faithful to this. We know that it is likely to be shorter and sharper than Delta, but the reality is, and when people ask, well, why would you call an election now? I made the point that we are literally trying to fight these things as one nation, and that in those circumstances, it is critical that we put this behind us. And why? If there was any doubt about this being a marathon, the news in recent days of a variant coming out of France should tell us that we remain at risk and that there is no telling what continues to lie ahead of us as we go forward. We are not even good into Omicron, but we're talking about a new variant potentially. And we are not even good into vaccinating numbers globally in Africa and in Latin America sufficiently, so that we know that the risk for us to have these new variants will continue for some time. We are asking Barbadians, therefore, work with us and to understand that the whole concept of self-isolation puts on you the responsibility to mask and double mask if you have to. But the bottom line is, do not mix and mingle if you know you're positive. And for those of us who are moving around as we go around, continue to wear a mask and continue to take all the precautions. Bounce, no shaking of hands. And these are the things that can help us get through this. And why? Is Barbados on Mars? No, it isn't. Barbados is right here on planet Earth, the same place where the United States of America has recorded on the 3rd of January 1 million cases per day. Barbados is on the same planet Earth as the countries from Europe and from the countries from Asia. So that we know that this 2-year exercise that we've been going through is hard. But at the same time, we are not the only ones being affected. And against that backdrop, we have to be prepared to take care of ourselves. I said at the beginning, our success has come by being prepared. Our success has come by ensuring that we put in place all of the necessary measures. We accept that in many instances, it's going to be difficult to test a lot of people, largely because the world itself is going to probably face shortages with respect to testing. And the Omicron literally outpaces contact tracing in a way that the health officials readily accept. So that it does mean take care of yourself. The good news is, as I said, most people have reported that this is for them no more than a bad flu, but by the same token, it will be for some a major issue. And therefore, we need to look out for each other, protect each other, and to ensure that we get through our business, and whether it is 4 weeks or 8 weeks, ensure that we get through this period. By the same token, we continue to be vigilant with respect to other variants, and we continue to ask Barbadians to recognize that the best way to fight this pandemic, the best way to fight all of the major national challenges that we have, is for us to do so as one people with one voice, and ensuring that we can do so together. This is the challenge that we put to each and every one of you, but we are confident, as we have been when it was no name other than a new pandemic, when it became Alpha at the beginning of last year, when it became Delta for us in the middle of last year, and now that we go into Omicron, the truth is that this is likely to be much, much less serious than Alpha and Delta, but we cannot take it for granted because of the high level of contagion that it has. You heard Dr. Ford say that it is likely that if you have one person in a house having it, that it will probably spread to others. So let us take our own health into our own hands. Let us be responsible. Let us recognize that as a nation we can overcome this. And let us do all the things necessary equally at this point to also to be our brothers and sisters keeper, recognizing that where persons need our assistance, particularly with the self-isolation and the home isolation, that we are in a position to be able to assist. Thank you very much, and I wish all of us the very best as we come together as one to mount this. We do not have, as you heard earlier, the formal results from CARFA yet, but the level of cases and the indications in the pre-screening would suggest that it is here, as I indicated on the 27th of December when we said it was our view that it was coming. We believe that we can do this together, and we believe that we can do this well. Thank you very much.
And thank you very much, Prime Minister, the Honorable Mia Amor Motley. Let me also thank the Minister of Health and Wellness, Lieutenant Colonel the Most Honorable Jeffrey Bostic, the Chief Medical Officer, Dr. the Most Honorable Kenneth George, the Deputy Chief Medical Officer, Dr. Anton Best, and Head of Isolation Facilities, Dr. the Most Honorable Corey Ford. Do have a good evening.